Depending upon which joint is affected, thankfully, we use our hands fairly similarly. So there are a few joints that tend to go faster than others. But first, it requires me identifying what the patients enjoy doing. Also, how much it affects them. If they're unable to do the most basic activities, if they're unable to ride their bike or play pickleball, those sorts of things, that tells me a lot about how much pain they're having. We'll also get a few we call patient-reported outcomes, which are just sort of standardized questionnaires to sort of see how much their symptoms are impacting their day-to-day activities. And certain scores could sort of tell you, hey, this person is stoic, and they're not really telling me how much this is bothering them because of just their own personality. So we'll get a few patient-reported outcome measures. We'll get some grip strength testing of their fingers and their hand. So all of that sort of goes into their overall profile. Then we start to talk about treatment options, and I always tell patients that I'm merely a consultant in this situation. I'll never tell you you have to have a surgery. You will tell me I'm ready for the next thing. And so usually it's sort of a stepwise progression of interventions. And that first starts off with, minor things like oral anti-inflammatories, topical anti-inflammatories if they're unable to take oral anti-inflammatories. Braces can be extremely helpful, particularly in situations where it's not always painful, but say they do something like gardening and it becomes painful then we can maybe circumvent that by supporting their thumb during that time so that they're not having pain afterwards. It could be therapy. A hand therapist can be quite helpful in certain situations to strengthen their hand and help them, say they have difficulties with jars. There are different things that you can do to open jars a lot easier. And I usually say that's sort of step one. And then there's step two, where you start to implement injections like steroids, and that can be helpful. Oftentimes, it lasts for about a year or so if we are lucky. So injections are really sort of a Band-Aid, but for some people, that's all they need. And that's all they ever want to do is come in for a yearly injection or two. And then we start to talk about surgical treatments after that. And usually I wait to have that discussion regarding surgical treatments because I don't want them to get overwhelmed with all the different options, but they need to know that there is something there if all of this were to fail. And the neat thing about arthritis is I get to develop relationships with these people that last many years, and never really signing people up for surgery for arthritis related issues at the first nor second nor third or fourth day that I see them, so it may be 2-3 years down the line before we start really discussing surgical interventions.